So actually, I'm going to have a follow-up question for Remo. So Shane was asking about just some concerns around safety in infusion centers, and I just wanted to get your sense on that. I know that you've been involved with the International Organization for IBD and looking at it not only at a national level, but also at an international level around infusion center safety. And if you could talk a little bit about that.
Yeah, and Gil, you've been involved as well, and certainly we have a task force not only in Canada but internationally, and we're going to review some of those guidelines tomorrow on a global call. But I can say here in Canada, and Gil, again, you've been involved, is that we've had discussions with the vendors of infusion clinics, and in other parts of the world, those infusions may be done in hospitals. And it really comes down to, I think, three key areas. One has to do with the patients themselves and pre-screening patients before they get to the infusion clinics. And so if you're a patient that goes to infusion clinic now, what you can expect if you haven't already had this happen is a pre-screening call to make sure that you don't have any symptoms that are suggestive of COVID disease. And if you are sick, you'll have a follow-up call and probably have your infusion delayed. Similarly, there will be screening sort of at the door per se, where temperature checks will be done to make sure that you don't have an elevated temperature as a marker of possible subclinical disease without, say, cough and maybe shortness of breath or a sore throat. And so that's on the patient side. And then we're recommending some very, very strict guidance regarding the clinic itself and social distancing and the behaviors of the workers within those clinics to make sure that not only do they wear or they adhere to proper hand hygiene in between patients, especially in some of these clinics, one nurse may be being taken care of more than one patient, and you just don't want them to go back and forth. So proper hand hygiene in between, making sure that they're taking off their personal protective equipment in between patients, etc. And so I think that these are evolving, but I think that that's one area that we really want to make sure that our patients are safe in. And again, we're working with sort of the providers of these services to make sure that they're up to the highest standards to protect our patients.
And just to follow up on Remo's comment from a pediatric perspective, I know that some of the social distancing measures within infusion clinics is resulting, for example, in less visitation, obviously, unless you are a parent with a child. And I just wanted you to kind of comment on, what should parents who have children who are going to infusion centers, should there be any concerns, any extra precautions they need to do or consider?
I think nothing additional. One of the things that one of our nurses is doing is trying to make arrangements for families that are particularly worried to go to sort of the first appointment of the day at the infusion center. But I think the same precautions as Remo was talking about. And as far as I know, the parent is certainly still able to attend with them. And that would be in keeping with all social distancing practices.
Yeah, and I think just one comment. Sorry, go ahead, John.
Well, these infusion clinics are really an essential part of our service, and I think the efforts that you've made, Remo's made, and others have made around the world are really critical to make sure that we can continue to do this. As was mentioned at the beginning, staying on therapy, we think, is really very important to protecting our patients against flare of their disease, which then leaves them more vulnerable to coronavirus infection. So it really is important. And I can speak from my experience interacting with the infusion providers in our area. They're taking this very seriously to make sure that they can continue to operate. And that means protecting their own personnel as well, because they have only a limited number of employees, and it's in their best interest, it's in our patients' best interest to be sure that they adhere to the highest standard and protect not just the patients, but also the people providing care in those clinics. So I'm very optimistic that they'll continue to provide service and that they'll continue to be safe environments for our patients.
Yeah, And the one statement I just wanted to make that's clear so everyone knows is that there are 4 major infusion networks. They're working together collectively to address a lot of these issues. They're also working with each provincial health authority, health government, and every province across the nation has deemed infusion networks an essential service. That means that if there was a provincial, regional, or national lockdown, infusion centers would not stop. They would still be open. Nurses would still be working there, patients would still be allowed to go there.